Medicine for me has always kind of been like the family business. On my dad's side, I come from a long line of physicians and just medical providers, and then my mom was a nurse. So growing up, I just had a lot of exposure to the medical field. I think with parents, well, at least with my parents, they never wanted to push anything on me, but it was always their biggest hope that I would kind of follow after my dad and after my brother. And so it just so happened that I also appreciated medicine and I liked seeing what my dad and my brother did. So it was really cool to me. And then once I did kind of end up in med school, I think that love from them kind of developed into my own passion for seeing patients, loving what I do. Back in high school, applied to Augusta University, which they had this amazing opportunity called the Professional Scholars Program, which is a combined 7-year program that just combines your bachelor degree and also your medical degree. And so at that point, it was just a super exciting opportunity for me. Augusta was just super close to home. Financially was a great option. So I applied, not really thinking I'd get in, but once I got the acceptance phone call, I forgot to check all of my other applications or acceptances, denials at other schools. College is such a unique place for people to grow in, and I think being here was exactly where I was supposed to be. I think I gained some of my greatest lessons here, learned some of my biggest pitfalls, but it was very unique in the sense that I was going to a school knowing exactly where I would be 4 years down the line. One of the defining moments in my med school journey was being a part of MCO, which is Medical Campus Outreach, and off of that they have a great opportunity for first year students to go to Tijuana for a medical mission trip for a week during one of our 2 weeks of summer vacation in between our first and second year. And so I went my first year and it was just absolutely life-changing. Getting not only to see, to kind of apply what I've learned in the past year, but just to kind of see real life medicine outside of what we traditionally see in the hospitals, in the States. But I think it just really helped me grow as a person, as a student, and I really enjoyed it. So much so that I voluntarily went back 2 more times after my first year. At the ripe age of, I want to say 10, I had told my parents, I was like, I want to be an OB GYN. All the way up until med school, the first specialty I shadowed in med school was OB/GYN, and then after that, I don't know if it was just a bad day or if I ate something wonky in the morning, but afterwards I was like, this might not be for me. After that, the rest of my med school journey was just kind of me trying to figure out what I wanted to do. I knew I wanted to do something surgical, so I went as far as declaring general surgery as my specialty of choice. But at that point, I hadn't officially done my OB/GYN rotation until the month after, and within 3 days, I knew I needed to change my declaration back to OB/GYN just because it was a light bulb moment. I know it sounds super cliche, but working with women, seeing them at during their visits, it was just so fun, and I just realized I loved every part of it. But I actually ended up here at MCG, which is really cool. I think it says a lot to the program that after 8 years, I still want to be here. But I think the people are a big part of what kept me here. I just remember on match day, after I found out, and I'm sure they subsequently found out shortly after, but the overwhelming excitement and support I just got from everyone in the department was overwhelming, and it was just so sweet to just feel loved and accepted and feel like I belong here.